Welcome to Cedars-Sinai Medical Center and the Diagnostic Radiology Residency Program. I'm happy to talk with you about our program and our hospital community here in Los Angeles. My name is Tom Lurch. I'm a musculoskeletal radiologist and I am the residency director. Cedars-Sinai Hospital was established over 100 years ago, and since its inception has been a leader in high-quality care to the community of Los Angeles, the state of California, and to the world. It is known for outstanding patient care as well as educating health professionals in all aspects of medicine. We are dedicated to the health of our community, education, and research. We are the largest nonprofit community medical center west of the Mississippi. We do a tremendously high volume of imaging studies. We are tertiary and quaternary referral center specializing in unique and complicated diseases. We are one of the biggest transplant centers in the country. We have a level 1 trauma center with a very busy emergency department. Our numbers are big all over. We have approximately 900 beds, which are always full. We have about 15,000 full-time employees. We are large and very busy, and we also are very well respected in the community and throughout the nation. We consistently win awards for outstanding hospital services and programs. Our radiology department is continually growing and is very stable. We have a very low turnover amongst our staff and amongst our technologists. We have had a long-standing diagnostic radiology residency program, and we are very proud of our trainees and graduates. We feel so strongly about them that we have hired many of them to join our practice. We have just recruited another one of our trainees who will be joining us in body imaging. Cedars ranks among the nation's top independent hospitals in NIH funding and research. We have a PhD program in biomedical and translational medicine. We have multiple active research trials and projects. We are a major training center with 13 residency programs and 72 separate fellowship programs. Our residency programs are excellent and offer the highest level of training. We have state-of-the-art imaging equipment and continue to grow in this regard. We now have more 3 Tesla magnets than we have 1.5 Tesla magnets. We have multiple multi-slice CT scanners as well as a dedicated 3D lab where technologists do nothing but reformat scans and do advanced 3D imaging. We have 4 PET-CT fusion scanners, and we are one of the few institutions to have PET MRI fusion as well. We have an enviable attending to resident ratio. Many programs strive to get to a 1-on-1 ratio between attendings and residents. As you can see, our attendings far outnumber residents. That means when you're on a rotation, you are working side by side with an individual radiologist. You are never the third person in the back row trying to see what someone's pointing out on the monitor. You are there with the individual radiologist getting trained one-on-one. If you compare the number of residents to the number of faculty and the number of studies per year, you can see that ratio is clearly in your favor, with a large faculty and large study volume here at Cedars. You will see and do a tremendous amount of radiology, both diagnostic and procedural. We have multiple other conferences embedded into the program and embedded into the various resident rotations. For instance, in musculoskeletal radiology, we have monthly conferences with orthopedics and with rheumatology, and twice monthly sarcoma conferences where we review our biopsy results with pathologists, surgeons, and oncologists. Radiology call is what we consider our ER rotation. Our ER rotation is unique in that there is always a board-certified radiologist at Cedars-Sinai Hospital 24 hours a day, 365 days a year, in-house. Our inpatient service and emergency room are incredibly busy, and there's no way that it could be handled by just a resident on call. We have an attending radiologist in-house working with and teaching our residents on call. That makes your call an opportunity for education, and it makes it a safe call. Our ER rotations get excellent resident feedback. I know many of you graduate with incredibly large student loans, and I do want you to know that moonlighting is permitted here at Cedars. We have moonlighting opportunities at Children's Hospital of Los Angeles, as well as internal moonlighting opportunities in our own department, which are currently expanding due to our high volumes. Our fourth-year residents get up to 6 months of elective mini fellowship time, usually concentrated amongst a few subspecialty areas. They can choose from multiple rotations as well as research months. Residents have chosen a variety of different areas to do their mini fellowships, and of course we do offer the early specialization in interventional radiology if the resident decides that this is the area they want to pursue in life. We are certified for early specialization in interventional radiology. If a resident decides that interventional is a subspecialty of radiology they really want to pursue, this can be done through our program. Interventional electives can be taken, and this resident can apply for a 1-year independent IR residency and be eligible to sit for the interventional radiology boards. Since we are a very busy procedural program, the resident will be involved in procedures in all their rotations. Last year, we graduated our first ESIR resident, who is now at UCLA doing his final year of interventional radiology training. Scholarly activity is encouraged and required. Our residents publish and present regularly at all the usual radiology and subspecialty society meetings. There are plenty of opportunities to get involved with research projects and doing case reports. We also have a resident choose to do an international radiology elective when he arranged to spend time at a hospital in an area close to Mount Kilimanjaro. He had a fantastic experience and came back and gave us interesting lectures about the pathology and problems that he saw in Africa. In addition to living in Los Angeles, in a dynamic area of the city, we have multiple other perks that we like to brag about. Our most recent benefit is an additional $10,000 housing stipend paid to residents at Cedars. There are several other perks, including tuition review course payments and meal supplement aid. Cedars has multiple strengths, including a very diverse and complex patient population in one of the most diverse cities in the entire world. The residents get experience and exposure to comprehensive and diverse pathology, and they get to study this with advanced state-of-the-art imaging in a state-of-the-art hospital. We have an excellent teaching staff with no turnover. We have incredible technologists and support staff that really make our days go better. Cedars was the first radiology department I've ever seen that has dedicated radiology nurses who work with us and help prepare patients for their biopsies and procedures. They are a great resource. We have a cohesive residency group that goes on to incredible fellowships and career opportunities. I can't emphasize how wonderful our support technology staff is. This is John Weegley, one of our X-ray technologists, who won the coveted Safety Star 2 times in 1 month. This is essentially unheard of. Keep in mind there are 15,000 employees here, and for him to be recognized twice was just incredible. He was recognized when performing an intraoperative abdominal radiograph for a missing sponge. The patient was large, and the radiograph didn't cover the lower pelvis. The surgeon said it was all he needed to see, but the sponge wasn't there. John insisted that he had to cover the pelvis because this is radiology protocol. The surgeon was irritated, but John persisted and did the lower pelvis radiograph and found the missing sponge. He was also recognized for noticing an abnormality on a postoperative cervical spine radiograph on an outpatient study. Before he let the patient leave, he called the neuroradiologist, who subsequently contacted the neurosurgeon, and the patient was back in surgery that evening. I'm very proud of our technology support staff, and I'm very proud to work at a hospital that actually recognizes their incredible work. We also have a presidential award given only to a few people every year for outstanding service. I'm proud to say that Joey Stuckelman, our residency coordinator, received the presidential award, as well as Arturo Amaral, who is a tech aide who helps with every procedure and biopsy that we do in CT. He is absolutely stellar and a pleasure to have scrubbed in on procedures. Our patients are very grateful for services they receive and frequently send standing ovations to our various residents for their excellent work. At the end of residency, you can expect to be a well-trained radiologist. Our residents have a 100% pass rate on the board examinations and 100% fellowship placement and fantastic fellowships throughout the country. Lastly, I want to emphasize that Los Angeles is a wonderful city to live in. I grew up in Chicago and came out to Los Angeles for residency and never went back. We have no winter here and have a large and diverse city with incredible cultural attractions, wonderful restaurants, and great leisure activities to pursue. There's something here for everybody, and it's kept me here my entire career. I hope you enjoy your interview process here, and I hope that you will strongly consider Cedars-Sinai as an outstanding educational opportunity to pursue diagnostic radiology. Thank you for spending time with us this morning.